Salter, and later Wolpe, used learning principles as a guide to devising new therapeutic methods. While Dollard and Miller's book has had limited impact on both theory and practice, Salter's strategy has made enduring contributions. In lively, literate, and sometimes puckishly provocative prose, Salter courageously and successfully challenged the establishment and articulated a vision and a set of techniques that have become so widely accepted and applied that he is often not formally cited. This is especially true when contemporary writers in psychotherapy refer to assertion training, expressiveness training, and getting in touch with one's feelings. These and related phrases refer to the expression of both the positive and negative emotion that people, to their detriment, are often reluctant to do under a mistaken belief that they will infringe on the rights and sensibilities of others. The central thesis in the present volume is couched in Pavlovian terms, to wit, that the direct expression of both positive and negative emotion leads to improvement in a wide variety of psychological disorders via a disinhibition of excessive cortical inhibition. While the theorizing was open to question, the techniques Salter derived from the theory were effective for a wide variety of disorders. This kind of disconnect between theory and technique is not uncommon in scientific and clinical applications. No lesser a figure than Sigmund Freud has been evaluated in this light, as well as other major figures in psychotherapy, including Carl Rogers. Throughout his application of the techniques, Salter's emphasis was on changing overt behavior, rather than on changing thoughts and feelings. Changes in the latter would follow behavioral change, he cogently argued. This approach was in sharp contrast to the prevailing doctrines of the insight-based therapies, in particular, psychoanalysis and its many offshoots. I believe Salter has been proven right, much to the benefit of many patients, their pocketbooks, and the financial resources of insurance companies. Less generally known than Salter's assertion training is this avowed behaviorist's innovations in the use of imagery, specifically paired with positive effect, to reduce unwarranted anxiety. But it was this idea that helped to lay the foundation of Joseph Wolpe's pioneering work in systematic desensitization. The degree to which an appeal to imagery is within the realm of behavioristic techniques has been argued for years. But Salter was always in good conceptual company with the likes of Clark Hull, Kenneth Spence, O.H. Maurer, and Neil Miller. Though humanistic in his values and in his clinical approach to patients, Salter, like Pavlov and other Russian and later Soviet theoreticians of the time, remained a philosophical materialist in his theoretical conceptions of behavior and its therapeutic modification. In Conditioned Reflex Therapy, he wrote, "We attain behavior change by what may be termed verbal chemistry. Words, spoken by the therapist, travel along appropriate nerve tracks in the person under treatment and produce chemical modifications in his nervous system. These changes are associated with behavior changes, which in turn precipitate more biochemical modifications and more behavior changes." Like other trailblazing and creative thinkers, Salter's ongoing influence extends beyond behavior therapy and psychology generally. In the field of psychotherapy, he emphasized the importance of I talk, years before Fritz Perls pointed to its significance in Gestalt therapy. Assertion training has permeated our culture, especially in the feminist movement, a fact which made Salter very proud. Ironically, being an innovator does not guarantee that one's contribution will receive due visibility. So just as references to psychoanalysis seldom cite Sigmund Freud, a similar scarcity of citations to Salter occurs in the literatures on assertion training and the origins of behavior therapy. A wide variety of people beyond psychologists and other mental health professionals read and praised his writing. Who among us can say that our writing